Hey there, I'm Dodge with McGrath Medical. We recently had a question revolving Accutane. Accutane's an acne medication that one of the things that it does, it helps reduce sebum production or oil production around the hairs. So the question was, will it cause hair loss? And if so, how long should somebody wait before doing a hair transplant? Accutane can definitely cause some hair loss. The good thing is it's typically temporary. I would suggest probably being off of it for around 4 to 6 months, just so that things can start to recover. And you know, it's also kind of individualized. Most medications that can cause some hair loss or temporary, you have something like chemotherapy. We often see some pretty significant hair loss with that. A big difference with something like chemotherapy versus Accutane, where it actually pushed the hair into the end stage of the hair cycle, telogen phase, and then that hair would fall. Chemotherapy is actually anagen phase hair loss, which is where the hair is currently growing and it's going to all rapidly fall out. So some other medications that could potentially cause is actually normal diabetes medication that's actually very well thought of. It's even used some in anti-aging, is metformin. Metformin can actually deplete some B vitamins. Not everybody reports hair loss, but it does. There are times where people will report some hair loss within 4 to 6 months. So typically, if you can replace, B12, folic acid, things like that, you can kind of revolve that. And once again, if it were something that you were to stop, you would no longer have over between 3 and 12 months, you would see that come back. Other things that are in telogen hair loss. There are even kind of random things like if you get a virus. Something that's been pretty well documented now is patients that have COVID. A lot of time, 2 to 6 months, I'll be getting a phone call saying they're getting mass hair shedding. That's in the telogen hair loss. That hair will typically grow back between 3 and 12 months. One thing with all medications you have to keep in mind though, is if you are genetically predisposed to hair loss, it could progress that genetic alopecia, whether it's most likely androgen alopecia. A few other medications, mostly kind of unknown reasons, are some different high blood pressure medications have been documented with that. Some birth controls have documented hair loss. Usually those are going to be the progestins that can cause that. Using any kind of stimulants, that can also increase the telogen hair effluvium. Nicotine, things like Adderall, or even too much caffeine, all of those things are going to increase your cortisol levels. All those can cause that hair to be fall out over time. If you reduce that intake, you most likely will see some improvement. Something that's also not thought about often are things that would actually disrupt digestion. If you're someone who suffers from heartburn and often is having to take Pepcid or pantoprazole or anything like that, if you're having poor absorption, that can cause some micronutrient deficiencies. So in that case, you could potentially see some hair loss that way. Hair is kind of somewhat considered not essential to the body. So if you're deficient in some of these micronutrients, you could potentially see some hair loss. Obviously, we're not really here to treat gut issues, but if you feel that could be something going on, I would definitely suggest looking into some digestive aids to help out with that. Other things that are often used are different like hormone therapies. Guys that are on testosterone, things like that, it's got to be thought about, because when you increase testosterone, you're going to increase DHT, and both of those things can cause some wilting away, which is one reason we use a lot of finasteride here at McGrath Medical. All right, well, I hope that helps. If you guys have any questions, feel free to reach out. We're always happy to talk about it and help with some of those answers. A lot of these drugs, there's really not a mechanism of action knowing exactly what's going on that we have the hair loss, but we're here to help, and we're here to continue the journey. So thank you.